Hi, I'm Dr. David Chen. In this segment, we're going to be discussing about TMJ dysfunction. What is TMJ dysfunction? TMJ dysfunction refers to the pain associated with the TMJ joint and the surrounding areas, the muscle included in it. It is a very general term that does not refer to the specific cause of the TMJ dysfunction. In simple terms, the TMJ joint consists of upper and lower jawbone and the soft tissue that is a disc that is in between the upper and lower jawbone and is surrounded by ligaments. What are the common symptoms of TMJ dysfunction? In dental offices, generally we'll see clicking, popping, pain in the jaw joint, pain in the muscle, cannot close down fully, cannot open wide, changes in the bite, headache, earache, ringing in the ear. How do we determine what's the cause of TMJ dysfunction? TMJ dysfunction is a fairly complex subject. It does not have a simple solution. So we have to utilize different parameters to determine the cause of TMJ dysfunction. We would use history. If you have a trauma to the jaw joint in the past, have your bite changed in the last little while? Do you have any sleep apnea issues? Do you breathe through your mouth versus your nose? Do you breathe using your diaphragm versus your chest? For the structure, we would utilize CBCT, 3D imaging technology to view the TMJ joint. It is only a hard tissue sort of imaging technology, not a soft tissue. For soft tissue, you need an MRI for that. Then we would look at the clinical parameters. What are the clinical parameters that we would be looking at? For example, we would look at maximum opening of about 40 millimeter at least. We would look at the deviation, not the deviation, but the movement to the right and left about 8 millimeter. We would look at deviation on opening to one side or the other side if we have any. We will look at doing the load test on the jaw joint, and we will look at doing immobilization test on the muscle itself. And we will also check for any worn down tooth surfaces that may be contributed by the dysfunction itself. What are the causes of TMJ dysfunction? TMJ dysfunction can be caused by medical conditions such as rheumatoid arthritis. In this segment, we're going to restrict our discussion to dentally related TMJ dysfunction. In the past 50 years or so, dentistry has placed an emphasis on occlusion of the bite being a major cause of TMJ dysfunction. More recent evidence suggests that sleep apnea or sleep bruxism as a major cause of TMJ dysfunction. However, having said that, if you have a better bite, generally the joint will be much more resistant against forces that are generated from sleep apnea or sleep bruxism. Other causes of TMJ dysfunction could be trauma, could be breathing through the mouth versus the nose, and also breathing through using the chest versus diaphragm. What are the treatment for TMJ dysfunction? Treatment for TMJ dysfunction can be sequenced into short-term treatment versus long-term treatment. Short-term treatment is essentially to take care of the pain associated with the joint or the muscle, and those can involve using anti-inflammatories such as ibuprofen to reduce the pain and inflammation, use a night guard to reduce some of the discomfort, use some muscle relaxant to reduce some hyperactive muscles. You could use Botox, or you could be referred to a physiotherapy clinic for them to work on the muscles. You could use ice pack to reduce some of the inflammation, and also staying on a soft diet. The long-term treatment of TMJ dysfunction may involve CPAP or sleep appliance if the cause is sleep apnea. In upper airway resistance syndrome cases, the dental arches can be widened by using aligner therapy such as Invisalign. The tongue can be retrained by using myofunctional therapy. In chest breathing situation, you may use diaphragm breathing. In mouth breather, try nasal breathing. Now, the occlusion should be as ideal as possible to resist the external forces that are being generated, such as like when you have sleep apnea. This concludes the discussion on TMJ dysfunction. I'd like to thank everybody for watching the video. If you have any questions, you can contact us at www.drchangs.com.